Hi, my name is Dr. George Zanianis, and I'm one of the orthopedic surgeons here at the Woodstock Hospital. I'd like to take a few minutes to share some information with you about your upcoming total joint replacement surgery. You have likely already discussed the surgery with your orthopedic surgeon and are planning to go home the same day after the surgery. We want to make sure that you have all the information needed to ensure that your surgery and recovery progress smoothly. 2 months before the operation, you want to ensure that you are eating a balanced diet with several servings of fruits and vegetables as well as whole grains. Try to have protein-containing foods at each meal, as these are the building blocks required for healing post-surgery. Drink plenty of water and avoid sugary drinks like soda and juices. If you are diabetic, you want to make sure your blood sugars are well controlled. Ask your family doctor to test your hemoglobin A1C. It should be less than 7.5. If you are a smoker, now is the time to quit to decrease the risk of infections and blood clots after surgery. A week prior to surgery, you want to get your home ready for your recovery. It is important to ensure that your kitchen and pantry are well stocked with healthy, ready-made meals to enjoy for the first few days after the surgery. You want to ensure that your home is free of any trip hazards, such as loose rugs. Be prepared to do most of your living on one level to minimize your need to use the stairs. Physiotherapy is an important part of your recovery. You want to stay as active as you can prior to surgery to keep your muscles in good tone and your joints moving as well as possible within the limits of your arthritis. You will be meeting with a physiotherapist prior to the surgery who will discuss what to expect and the equipment required after surgery. You will need to have a responsible adult who will be with you for at least the first 48 hours after the surgery. This will be your care partner, and they will need to drop you off for your surgery and pick you up afterwards. They will need to help you with your meals and your personal care for those first 2 days after the operation. Infection is a very serious complication after joint replacement. Please inform your surgeon's office if you developed any dental, skin, or urine infections leading up to surgery. Also let your surgeon's office know if you develop any cuts or scrapes over your hip or knee prior to surgery. If you present on the day of surgery with any of these issues, your surgery may have to be canceled. When packing your bag for the hospital, make sure you include loose-fitting clothing and comfortable sneakers to wear during your physiotherapy session. Shower or bathe the day before surgery, and if directed by your surgeon, use antiseptic soap 2 days prior. Don't shave your surgical site. This will be done just prior to surgery if required. After your surgery, you will wake up in the post-anesthetic recovery unit, where a nurse will ensure you recover safely from your anesthetic. You will also have an x-ray of your new joint replacement. You will receive medications to minimize any nausea and pain. Once you have recovered from the anesthetic, you will be transferred to our day surgery unit, where the nurses will help you get ready for your first physiotherapy session with your new joint. In the physiotherapy gym, the therapist will walk you through your exercises you will need to do for your recovery. They will show you how to safely use your walker and how to ice your joint to decrease swelling and pain. There are stairs in the gym where you can safely practice if you need to use the stairs at home. After you are cleared by your physiotherapist, our team will ensure that your pain is under good control, your vital signs are stable, and you're avoiding well before you go home. Oftentimes this will be close to supper time. When you are discharged from hospital, you will have several prescriptions for medications to take after your surgery, including your pain medication and a blood thinner. These can be sent to your pharmacy before you leave, so they are ready to be picked up by your care partner. When you go home, enjoy one of your pre-prepared meals and try to get to bed early. You have had a full day. Your surgeon and nurse will contact you the next morning for a virtual follow-up visit. I hope this video has been helpful in guiding you through the preparation and recovery after your total joint replacement. Best wishes for a safe and speedy recovery.